Get my shoes.
They're not gonna. Nobody's gonna see them.
Okay, I think we're live.
We are live. We are rolling.
Okay.
I cannot think of a better way to spend a Thursday night.
Well, this is not bad.
Cheers.
Not a bad way to
Cheers.
start the evening.
It was a busy week, wasn't it?
It was pretty intense. I didn't even stop to eat lunch today, so.
Yeah.
This
Lunch.
could be,
Did you get some food?
I had a Cliff Bar, actually. So
Okay.
I guess that counts.
Wait, I think I saw you eating some Fritos in the
No, I didn't.
in the
I
lunchroom.
didn't eat any chips today.
No, none today.
I resisted the urge.
Oh, and then you made the ugly face when I gave you those thin savory crackers.
No.
You were like, no.
No fat, no fun.
No fat, no fun. Okay, so tonight I'm here in lovely Corona del Mar at Dr. Christopher Ellstrom's home, and we are going to discuss all things plastic surgery, what's been happening in the world the last year, and then the last 5 years, like how much plastic surgery has changed the landscape, what people are doing, how they're so much more willing and ready. All of those things we're going to talk about.
Sounds like a lot to talk about.
It is. It's a lot, but I think you and I can handle it, can't we?
I think so.
Yeah, I think so. So Dr. Ellstrom's been with our practice for 4 years now, and went to a bunch of very prestigious schools, little USC, little Loma Linda, little UCI. You're kind of killing it with the school resume and a board certified plastic surgeon. Mm-hmm. Tell me, because I know the plastic surgeons get a little bit like worked up. I'm getting hot in here. Get a little worked up about
Hold up on that one.
The difference between a plastic surgeon and, let's say, a facial surgeon.
Okay.
Tell me what the difference is.
More, it's like, what does it mean to be board certified plastic surgeon? So, like for our specialty, it's actually a 6-year training program. If you're doing integrated plastic surgery, which means you go right into plastic surgery out of medical school. So you do 6 years of training. Most of us will do somewhere between 4,000 and 5,000 procedures in training over a broad spectrum of plastic surgery. So, I mean, we do everything from burn, hand, cleft lip, and other orthodontic and craniofacial surgery. All the cosmetic surgery, so breast, face, body, all the breadth of that, and then breast reconstruction, hand surgery. It's quite exhaustive, all the stuff that we have to learn and train on. So once you go do your training, you have to take a written exam to kind of cover all the breadth of that. And once you pass that, then you can sit for an oral exam where they survey all the cases that you've done for a year, pick a selected few, to make sure that you're doing everything correctly.
Random, right?
At random.
At random.
Could
Out of
be
100
anything.
cases. Yeah.
So you got to make sure all your T's are crossed, I's dotted, or they'll catch you. But it just keeps everyone accountable to make sure they're doing the right stuff. Mm-hmm. And then you pick your selected cases, create exhaustive books of all that, where every little piece of information's in there, and then you fly out to Arizona in this lovely hotel with 200 of your best friends, and you do this exam over a couple days where they quiz you on all your cases, then a bunch of random cases that are standardized. And if you can pass that, then you can become board certified. So it's pretty intense, and it'd be nearly impossible for someone who hasn't done the training to be able to pass through that.
Right.
So, and you obviously
Passed.
I did, yeah.
Yay! Woo!
It was grueling, but it's worth it.
Yeah, of course. So fast forward. Now you've been with our practice for 4 years, and your business has just grown by leaps and bounds. And I have to say, like, it's been a rough year for the country and the world as a whole, right?
Absolutely. Yeah.
Like horrendous things have happened, like difficulties and like just across the board, like grandparents not being able to see their grandkids and parents having to stay home to do homeschooling and
Graduations, and like my nephew's a freshman in college.
He might have set foot on campus, but he's not gone to college. Like all these like life changes, but plastic surgery is thriving. There are so many people that just are
Using this time
to get stuff done that they've been maybe
thinking about or never thought about before, but they saw the Zoom face and they're like, oh my gosh, like I can't
can't like look at this anymore. What do you think?
what do you think
Has contributed to
your
schedule being so
jam
packed with surgeries nonstop?
Well, yeah, I mean, as you said, I mean, it's been a pretty wild year. I mean, those first couple months, April and May, I mean, we completely shut down shop just because we didn't know if things were going to be safe. But, you know, after kind of review and, you know, looking over the evidence, like we could figure out we could do these things safely if we test everyone and take the appropriate precautions at all the surgery centers. So since we kind of restarted that, I mean, everything's gone very well and have had a perfect safety record, no transmissions as far as we know. So from that aspect, everything's been great. And I think, you know, to your question, like why is, you know, there's been such an interest. I mean, you know, people are going nowhere, no vacations, they don't have to see anyone in the office. So it's actually a great time to get a lot of this stuff done. And if people have, you know, instead of going on that trip, maybe you go get that little procedure, you know, that you've kind of been thinking about. And since you don't have to see anyone, great time to recover.
Like historically, Christmas time, Thanksgiving time, those in years past have always been when people have been like your schedule's been like busy
let's pack it in around Christmas. I don't have to see anyone but my family, and they're going to know anyway.
Right,
so
or I've got 2 weeks off, and I'm just like that's my time. And then, you know, COVID hits, and people are like, "Well, I'm working from home."
Yeah.
Or
if I go out, I'm wearing a mask.
Exactly.
So, and then they're saving their pennies, right? Because they're not going out to dinner, they're not going on trips, they're not buying new clothes for work. They're, you know, they don't spend their money on anything else.
So I think, yeah, that's part of the drive. But the other fact, I think you'd mentioned, you know, probably the Zoom effect, you know, kind of what we're all referring to it as, is, you know, all this video conferencing and, you know, video conversations are really driving you know, people's desire to get a lot of these things done. I think for the first time ever, people are really looking at their faces on their computer screens, on their phones, scrutinizing all these little details that maybe they hadn't really looked at in the same capacity. And, you know, even with some of the best lighting, there's just certain things that, you know, you can't really hide as well. And so I think that's definitely, you know, created a huge uptick in a lot of facial procedures in particular. You know, so
a decrease in below the neck, right? Would you say?
I mean, I wouldn't.
You're like, I'm busy.
I don't know, but I mean, I don't know if it's decreased. I think it's just been a lot more interest in facial things. So, you know, for example, I think probably the biggest ones are upper eyelid surgery. So Blepharoplasty is the name for that, where we take out the extra skin, just because people are seeing that little bit of hooding that you can, you know, start to get in your 40s, 50s, or later sometimes, because they're seeing that and looking tired on their Zoom calls. And then facelifts, you know, also a big, huge thing that people are really, you know, having a big interest in, both because they can see kind of the jowling and poor neck definition, and they have time to recover from that.
Well, let's talk about
the recovery, because I like in the last 5 years, I would say my opinion, and of course I working in the field, I feel like plastic surgery used to be such a big deal, and it was like seemed like it was so, maybe not to you because you were doing it all the time, but to the layperson, to the regular Joe on the street, it seemed like it was a big undertaking. And or
that there was maybe a stigma about it, like you didn't really necessarily talk about it, or less and less over the last few years, but
more fear for me. Like I'd be afraid to do something, and afraid of the recovery, afraid of you know, looking overdone or too different. And I think that people's mindsets have shifted a little bit on where that is concerned. And, you know, you maybe could speak to that, where people are doing like smaller things along the way as opposed to doing these drastic, like Kenny Rogers. I'm trying to think of a few.
Well, that's more extreme because that was a more traditional.
Poor Kenny, he was so cute.
Well, yeah, but I mean, like, well, that's a separate issue, but that's more because traditionally, like when people did upper eyelid surgery, they were a lot more aggressive, took out a lot of the other structures, and hollowed out like a lot of the fat, which gave a more sunken appearance, when a more youthful eye has a lot more fullness to it. But more to your original question, I think, you know, that people are definitely more interested in doing like little upkeep procedures just to try and keep, you know, a more consistent look and appearance versus doing this big drastic change, you know, to, you know, completely change their appearance. You know, I think, you know, traditionally before kind of the advent of social media, you know, little skincare things, resurfacing things, I mean, yeah, it was like, oh, you know, maybe you do a breast aug in your 20s and then do, you know, maybe a lift in your 40s and then, you know, do a facelift in your 60s. And that was like the thing. And now there's like a lot more little finesse things that you can do kind of along the way just to make sure your appearance kind of stays more consistent versus doing all these.
It seems like it's all more preventative as opposed to, okay, you get to looking kind of really old and wrinkly. Okay, now let's take care of it. Right? Like you get to be 60 and you're like, oh, this is just a situation I can't deal with anymore. As opposed now it seems like it's changed. Okay, I'm maybe 50 and I got a little sag in the jowls, and maybe it's time to just kind of tighten that up a little bit, as opposed to doing this massive thing when you're 70.
I would say, yeah, that the age for facelifts, neck lifts, I mean, even upper eyelid surgery, it's definitely trended downward. Just because, you know, especially right now with everyone scrutinizing their faces, you're seeing these changes, and I mean, they're easy to correct. And it's just, you know, going toward a younger audience. And I would say, like when you're younger, like in your late 40s or 50s, it's easier to recover, you know, from a procedure like that versus, you know, if you're in your 70s or something.
Right.
And you know, what I tell people traditionally is like, you know, if you're looking at some of these problems, like looking at this channeling and it's bothering you, you know, like if you're thinking about it more than once or twice a week, you know, maybe it's time to think about doing something, because like you don't have to be concerned about that.
Right. It's a relatively easy fix that can have huge impact on your self-esteem and confidence and how you live the rest of your life. I will speak to plastic surgery. It's like, I can't believe you're going there, Kerry. No, because I'm kind of an open book, because I do feel pretty strongly about it. When I was in my 30s, which this was still pretty uncommon. I think it's much more common now. But when I was in my 30s, I was not overweight, but I called them like puppy dog eyes. Like I had like these, my sister's here right now. Like I looked kind of like a hound dog, and I had this fat pack over my eyes. And it wasn't age, it wasn't fat, it was fat, but it's just, that's how my body collected it. And I made the decision to have blepharoplasty then. It was not an easy decision at the time, but I made the decision because I was like, well, do I want to live like looking like this like the next 30 years and then fix it, or do I want to actually benefit those 30 years and enjoy the way I look? And I feel that I have a very natural looking eyes, and that they I didn't know Dr. Ellstrom at the time, otherwise I absolutely would have had him do it. But I'm so grateful that I made that decision and have been able to benefit over these years of like actually not having, like, you know, having my eyelids rest on my eyelashes. So I would encourage anybody that is, you know, kind of has a little self-esteem issue and maybe like feels like they don't look rested or they don't look their best, to at least have a conversation about it, because the blepharoplasty is really minimal downtime.
Yeah, I mean, it's something we just do in the office under local anesthesia. I mean, a lot of people don't even need sedation or, you know, anything strong. I can do it just under local and some Tylenol.
And you do bleph upon bleph upon bleph upon
I mean, that's
bleph.
probably the operation I do the most.
You do a lot of blephs, right?
Yeah.
And so you, like, you know, I don't want to, you take every case very seriously, and you're obviously you have a critical eye and you're very careful, but is it a simple surgery?
I mean, it's relatively straightforward. It's just something you have to be really precise on, because millimeters make a big difference there. Mm-hmm. You have to be, you know, really careful that you make everything match side to side, because if you're off a millimeter from one side to the other, it's obvious and you can see a difference.
Right.
And you have to take out just the right amount of skin that you still allow the eye to close while still having a nice smooth contour.
Right.
So yeah, I mean, there's a lot of finesse in it. It's not especially complex. I mean, most people do very well. Complication rates are extremely minimal. And generally satisfaction is super high. So I mean, it's one of my favorite operations to do.
Yeah.
But kind of speaking to your point, I mean, you said you did something in your 30s.
Yeah.
I mean, it's one of those things where there's not really like an age prescription. It's like at this age you have to do something. It's really like if you have a problem, you see hooding, or you see a little bit of extra skin that's maybe getting in the way of mascara or something. I mean, then it might be something you could consider.
Yeah.
So.
We do have a question from
one
of
of
our followers. DP Cycle has asked, you were speaking earlier about the ages and how it's scaling downward. Somebody's asked, like, well, what does the recovery look like when you're in your 60s? And
like for a facelift, I'm assuming. But
hopefully, DP Cycle, you can specify which procedure, but it's just asking about recovery.
Yeah, I would assume a facelift. I mean, like a lot of people have this perception that a facelift is like this huge, horrible, nasty recovery. And I would say, from my experience, it has not really been that way. I mean, yeah, the first night can be sometimes a little intense. Everything feels a little tight. But usually by the next day, people can be on pretty minimal pain control. I think my last two, they took some tramadol that night of, and then the next day they were just on Tylenol.
What I hear from patients when they're coming through is how they feel really tight.
Yeah.
And I think
Not
it's
that
good
they look tight.
They
It's
don't.
just-
They don't look tight. But if you think
the
about,
neck feels a little tight.
yes, and so if you think about like all the work that goes in underneath that muscle fascia, it can be
the SMAS.
The SMAS.
Yeah.
It can feel very tight, and so I would say that's something to expect. But,
Yeah, but
is it
pain-wise,
worse for a 60-year-old than it is for a 40-year-old?
I mean, it's more, I think, more like fatigue. It's probably
takes a little bit longer to recover.
It takes a little bit longer to kind of bounce back.
Rebound.
But I mean, really, most patients by 2 to 2.5 weeks are like they're feeling reasonable. Like you might feel a little fatigued, but I'd say generally most people are like back to the office by 2 weeks or so, and like feeling reasonable if you're still working or.
I've been very impressed with your patients when I see them on the back side. They don't look as swollen as I would have thought they would look. They don't look as bruised as I would have thought that they would look. I have seen patients after a week where I didn't know that they had a facelift, and I'm like surprised. Now that may not, I feel like I wouldn't look like that because I don't know if you guys have seen any of my videos. I get really swollen and I get really, I'm a over hyper reactor. But I've seen some patients where I'm like, whoa, you did what? Huh? Really? So.
Yeah, I mean, honestly,
you have a gentle touch.
I try and be really gentle because gentle handling tissue, that's what gives you a super fine line scar and, can kind of help make things look less done.
Right.
Because I don't want anyone to really look done. I want it to be very natural. I want people to kind of look and say, do you have a scar? Or not even really, make that statement even. I don't want people to even know.
Right. We would love to answer any of your questions, so please, keep asking if you have something.
Yeah,
this
keep
is
them rolling.
a special opportunity that we have to have Dr. Ellstrom here with us, or actually I'm here with him in his home, but it's a good chance for you to ask your questions and all of that. So we were talking about just how the landscape has changed for plastic surgery, kind of some of the types of patients you're seeing, and maybe why they're coming in. I know breast augs have kind of gone down. Like they're not as commonplace as they were, right?
I wouldn't necessarily say that. From what I've seen, there's still a huge interest in breast augmentation. I'd say it kind of skews more toward kind of a young 20-year-old, who wants just like a little bit more volume, or like, moms who's finished having kids and wants to kind of replace some of the volume that she's lost with breastfeeding. There's definitely interest kind of in those two demographics. But I would say implants are trending smaller. People don't want these huge pendulous implants or breasts that they may have been more interested like in the 90s or something.
Right.
It's usually smaller, more natural appearance. Or the other thing actually that's been seeing like a huge increase is transferring your own fat.
Oh yes, tell me about this.
For breast augmentation. So like a natural breast augmentation, so there's no extra implant or anything like that.
So wait. Oh, like for the people who don't understand, because I don't understand this one, are you saying that you could take somebody's fat from, let's say, their buttocks? I would never take it from the buttocks and say, thank you, Kim Kardashian. Okay. But if you take it from, let's say, an unwanted area, you can actually make an implant? Like, not an implant, but you could give enough volume to mimic a fuller breast.
Yeah. So I mean, there's limitations on that. Like you can't really have sagging with the breast, and you can only get about a cup size.
Are you able to talk about the breast without doing this?
That's my natural thing.
It's a thing.
Maybe since I don't have them.
I'm with you. I do it too.
But I mean, it's not going to be like an implant. It's not going to give you that high,
profile,
upper fullness that people like with implants. But not everyone wants that. As I was saying, implants are trending smaller. People are wanting a more natural look. And so if you just want, 200 or 300 cc's of volume, which would be maybe a cup and a half, depending on kind of your habitus, I mean, it's a great option.
Yeah.
And at the same time, we can take fat out of unwanted areas like the abdomen, the back, the inner thigh, or the inner arm. Those tend to be the biggest donor sites.
So never the butt.
Never the butt.
Not these days. Not these days.
I won't do that. Because, I mean, if anything, most people want volume back there. Mm-hmm. So, yeah, most lipo cases, it's like taking it out here, putting it up here, or putting it back here, depending on what people want.
Right.
But for breast augmentation, we can take everything out of the abdomen, out of the lumbar area, medial thighs, all that, and you can put in, a couple hundred cc's. You'll keep probably 2/3 of whatever we put in, and maybe somewhere between 50 and 70%, kind of depending on individual characteristics, how we harvested everything else, and whatever you keep, that's your own tissue.
Yeah. Are some people putting in smaller implants and then putting?
Yeah, well, that's actually been another thing I've been doing a bit more of, is like a composite augmentation. So particularly people have really wide set breasts. Even if
you did it again.
Well, I was just demonstrating. But if your breasts are really wide, that's not always something you can correct with an implant alone. So you can put an implant in, you can get things here, but you're really limited by where the muscle is in terms of how medial the implant can get.
Right.
So to help build up the breast a little bit, I'll put fat centrally just to help get a little bit more of that central cleavage, get the breast closer together, because everyone wants that cleavage so they can kind of show off in their dress.
Yeah, girl.
Hello there. But I mean, that's really what people want. They don't want wide breasts because it doesn't look aesthetically pleasing.
Right.
So yeah, doing a lot more of that.
Well, and
I have another question.
Oh,
Yeah.
okay. Yes.
Especially since you're talking about different options outside of implants, someone has asked, can you speak to the safety of implants? So,
yeah, I mean, there's definitely been an interest online about breast implant illness. I mean, there's been a lot of people looking into this, like, what's happening here. I mean, I haven't really seen a lot of convincing things that would, turn me away from doing implant surgery. After the 90s and all the concern about silicone implants, they were studied extensively and found to be quite safe overall. Especially the newer cohesive implants, even if there's a shell rupture, the gel inside tends to stay exactly where it is. So, I mean, my preference always is to go with a silicone implant. I think they're very safe. If someone had specific objections to doing that, there's saline implants that we can use if needed, or we can transfer fat like we've been talking about.
Right.
can you speak to the differences between saline and silicone as to the difference as to why someone would want to go one way over the other?
Yeah, so I mean, she asked if people could hear difference between saline and silicone. I mean, there's lots of discussion of this type of thing. I mean, my preference usually is to go with a silicone implant. I think it looks and feels more like a breast. I mean, people have some concerns about silicone, which sometimes leads them to go with a saline implant. It's a little bit cheaper to go with a saline implant because you don't have all the extra, engineering and material that goes into that. Downsides of silicone, you can sometimes get a little bit of rippling up at the top that could potentially be more visible.
I've seen that. I don't like that look.
Yeah, it can sometimes slosh or move around, or sometimes it's more temperature sensitive for some people. I mean, they're not drastically different if you have like a really thick layer of breast tissue over the top. But for thinner people, I generally lean more toward a silicone implant. And some of the more cohesive ones just kind of maintain a little bit more shape or fullness.
Right. I want to get into liposuction because
Oh,
I think
boy.
that,
Okay.
you know, we talked about fat transfer, but I think that liposuction is another one of those things that's so commonplace these days.
It really is.
And like an easy add-on, like, do you want fries with that? It's like if you're
Well-
coming in for your facelift or your whatever, it's like,
Well,
well, we're in the
typically-
surgery center already. Let's do a little
typically, I'm not doing
lipo.
that with the whole facelift, just because that's like a little bit much. I try and like keep things, under 5 or 6 hours or so, just to kind of minimize risk for patients. But lipo definitely has, seen a big uptick. I think people have been sometimes packing it away with quarantine eating,
Yeah.
and it's seen some.
Let me have another piece of cheese.
Well, I've seen some fullness or shape in places they don't want. That disclaimer though, lipo is not a weight loss procedure. It's a contouring procedure where you take fat from where you don't want it and optionally put it in places you might want it. But
Right.
it's really to try and create shape. So where I'm typically doing lipo is like arm in here, abdomen, lumbar back, and then inner thighs. Those tend to be the biggest spots.
Has liposuction, the procedure itself, become better over the last couple of years? Is it the same as it was 5 years ago, or is it better now?
The major difference, I think, in the last couple of years has been more interest in kind of high definition liposuction, where it's people that are a lot thinner that are getting it, and you're doing liposuction in a way that kind of emphasizes some of the underlying musculature. So you create negative spaces like in the abs or around some of the chest muscles or on the back muscles to really kind of show those off a little bit more. And you do that by creating kind of shallower areas where it should be where it should have some shadowing.
Didn't liposuction you kind of used to see like, I don't know, like sort of
Contour
lines?
deformities?
Yeah.
That's not really. That's always a risk, obviously, but I'd say that's less of an issue currently. Like for me, I will pass over an area multiple times. Then I like to pinch everything just to make sure it's a consistent thickness. So I don't really see contour irregularities where it's like lumpy, bumpy. That's definitely a concern patients will bring up to me. It's like, am I going to get this irregularity on my stomach? Is it going to look like cottage cheese? And that's not the case anymore.
And lots of people say, well, if you take it from here, will it just go somewhere else? Right?
You're taking fat out. It's permanently gone from that area that you take it from. If you are really committed to eating, you can eat through anything.
Committed to eating. I'm committed to eating, like breakfast, lunch, and dinner almost every day.
But really committed. If you're eating, chips, like, I won't talk about that. But if you're really eating unhealthy things, and you can, eat through any procedure. But the fat where you get it from with liposuction, it's permanently gone.
Right.
You could gain something somewhere else, but as long as you're maintaining a healthy diet and healthy lifestyle, generally you're going to maintain the shape that we provide you with.
Right.
2 questions.
Yeah.
That's come up. Someone's asked, can liposuction be done under local anesthesia?
Yes, but
Good question.
Yes, can liposuction be done under local anesthesia was the question. It can be, but I generally don't like to do that. It's a little uncomfortable sometimes, and particularly when you're really trying to contour everything, make sure it's consistent thickness across all the areas that you're working with. I don't like to try and do that awake. I feel like you kind of split your attention between making sure a patient's comfortable and getting the best result. Or if patients are uncomfortable doing it, like you might back off a little bit and then not get the result that you're both going for. So I will do little areas under local anesthesia. Going back to earlier discussion about zoom effect, we've been doing a lot of submental or like neck liposuction to get that double chin out of there. That's something I have to do in the office because it's a relatively small area. It's really well tolerated, and you don't need to go under general anesthesia to do that. But any major body stuff, I almost always do under general just because it'd be a little uncomfortable for everyone involved to try and do that awake.
Yeah.
And the next question is, someone's asked, are there any new procedures for cellulite?
So are there any new procedures for cellulite? We actually have this device called Cellfina, which is a device specifically targeted for correcting cellulite. It's an in-office procedure that we do under a little bit of sedation if you need, and local anesthesia through tumescent anesthesia. Essentially, this device goes in and like clips the little cords that create those dimples in the buttocks, thighs, other places. So people generally tolerate that pretty well, and the company actually has a fantastic guarantee just to ensure that everyone's happy with it. So they would cover, if for some reason you still had a dimple afterwards, they usually cover correcting that if you needed it. But generally, most patients are pretty happy with it.
Yeah, it's not for all types of cellulite, but we would need to do a consultation to see if you were a good candidate for that procedure. But it is, when it's the right kind of cellulite for that treatment, it's extremely successful, and we do have really good results with that. So definitely give us a call if you want to schedule an appointment to get a consult to see if you're a good candidate. And then that kind of guarantee that Cellfina has is amazing, and I think they did that because there's been so many, kind of hyped up cellulite treatments that don't work. So they're saying, "Hey, this one really does," and so give us a try. So,
okay.
Any other questions?
Not yet at the moment. So, ask those questions, audience.
Well, I want to circle back to the chin lipo.
Yeah. Don't look at me like that.
What do you think?
We're not going to have that discussion right now.
Okay, all right.
But I mean, I really like doing the chin lipo, just because it can really give that kind of chiseled, contoured, neck and jawline that people are wanting these days. I mean, you were asking about kind of changes over the last 5 years too. I mean, I think that's definitely something that's had an uptick as well, because people are doing these selfies all the time. I mean, there's definitely more of the younger group of patients, but they want to see that kind of shadowing under the jawline, the kind of defined angle in here, and liposuction is a great option for providing that. Typically how that works, just in case anyone's interested, is to do one little poke here, and then do one behind each ear, and through like a 2 or 3 millimeter incision, we can contour all this down and give really nice neck definition.
Easy peasy lemon squeezy, just like that.
Sometimes you can get a little bit of jowls if there's a little bit of fullness there, and people worry sometimes, is my skin going to retract? I'd say for most 20, 30, early 40-year-olds, like that's not even really a concern. You wear a little compression for 2 weeks and everything comes in really nicely. If you're a little bit older or worried a little bit more about neck laxity, there are some other options. We can use some energy devices concurrently with liposuction, which can help contour everything in and give you a little bit more defined neck without having to do a more major procedure like a neck lift or something like that.
Do you think, this is kind of a whole nother subject, but do you think that there's kind of like filler fatigue that's causing some patients to lean toward plastic or like face lifts as opposed to?
Yeah, I think that's a huge thing. I mean, especially because I think fillers and other injectables, it's kind of trending earlier and earlier, people getting it done at a younger age. And we're just seeing, people are filling their faces out with a ton of this volume. And you start to kind of lose some of the definition, or people start looking at every little wrinkle, trying to put filler in there, and they can end up with very heavy, like big round faces instead of a more contoured, kind of chiseled look, or well, maybe not chiseled for everyone, but the more elegant look. And so sometimes fillers aren't the answer, and surgery is a better option, even though it sounds scary. But it's one thing that can help correct, the laxity and other things that fillers just can't fix.
Right.
On a related note, we have a question from someone here. How about fat transfer to cheeks? Does it work? Does it last? And I assume we're talking about the cheeks.
Yeah. So I mean, that is something that we will do too. It's got a little bit different properties than fillers. It's not quite as stiff, but for hollowing, particularly like in this area, I'll see this a lot. People get a little bit of hollowing there, so their eyes can almost like be a little bit more protuberant. The cheek looks like it's sunken down a little bit. So, I'll transfer fat from an area where you don't want it, put a couple cc's of fat in here, you keep about 2/3 of it, and then you have a permanent correction that you don't have to have upkeep with fillers.
How do you keep it from moving around? Like, how do you get it to stay in the one spot that you want it to stay?
So you don't just suck it out from one area and just blast it all in with a Band-In. When you take out the fat, generally I'm using little tiny hand instruments that are very delicate because you want to be gentle with the fat because it's living tissue. You process it just to get it a more pure fat. You get rid of the oils, blood, and other fluids that are in there. Once you get a pure fat, I usually transfer it to little tiny syringes, and then you put everything in with a tiny cannula, which is a blunt instrument, and you do multiple passes and multiple planes, putting in just little teeny amounts at a time. By putting small amounts, it stays where you put it, and it doesn't go all over the place. If you just squirted it all in one shot, then it's going to migrate, and then the fat also won't get blood supply to keep it alive because it's living tissue. So.
Someone's asking a different person, but I assume it's related to this topic. Can you do that procedure in the office?
Yes. So someone was asking, can you do fat transfer in the office? I mean, it is something I do routinely in the office. Usually it's not going to be like major things, but if people have like a little deficiency right here, or commonly I'll do for back of the hands, people get kind of a sunken look. We can take fat from areas where they don't want it. Like you could get a little bit from the neck or a little bit on the inside of the knee, and you can transfer it to your hands, or put a little bit in here or wherever else you want it. Temples, another common spot, just to correct deficiency with a filler that's your own tissue and that's permanent.
What gets you like the most excited in the office? Like when you're like, oh, I get to do that.
So it's hard for me to pick when people ask me like, what's your favorite procedure? I mean, I like plastic surgery because there's a variety of stuff that you can do. I like doing a variety of things. That's what keeps it interesting to me. In terms of like procedures I like the most, probably like abdominoplasty,
really,
and facelifts, which they're kind of a similar operation, even though you wouldn't necessarily think that. But it's just taking this excess skin, fat, and other things, tightening some of the deeper structures that are kind of out of position, and making everything contour nicely, then getting rid of the excess to kind of give people a whole new shape and appearance. And they can be very drastic, like in a good way, and that people can be it can be life-changing operations for a lot of people.
Tell me about one time where you had a life-changing operation where somebody
well, it sounds crazy. It's like when you say like abdominoplasty changed
It
my
actually
life.
Doesn't to me, because
Okay.
I do think that it can affect people's whole lives.
I mean, I had one lady in particular. She had a little bit of fullness down here and was just very self-conscious about it. She had trouble fitting into pants and other things because they wouldn't kind of buckle around.
It's like she had small legs, but she was bigger here.
Yeah, she just held on to a little bit of stuff
right
down here. And just, taking that out, I told her, like, I'm going to get you in a bikini, after we're done all this. And she's like, that's insane. That'll never happen. Blah, 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 blah. Like, that's crazy. So we did the operation. We gave her like a nice waist that was contoured, did a super low scar so she could fit into a bikini without having a scar that's visible. And I mean, a couple months later, she showed up for her post-op photos in her new little bikini, and she was like super pumped about it. Got a whole new wardrobe, was just really happy. And I mean, she told me like this really, changed my life. So as crazy as it sounds, doing an aesthetic procedure like that, it really can be powerful for people.
And circling back to the fat transfer procedures, we had one question from the audience saying, at what age is this surgery appropriate?
So, for fat so someone asked, at what age is it appropriate for fat transfer?
Does your fat go bad when you get old? Is that what you're saying?
No. I mean, it's kind of in what we had said earlier about, is there a right age for any procedure? And there's no like specified age for any procedure really. It's like, are you a good candidate? Do you have a problem? Is it something that bugs you? Could I reasonably make a correction with the anatomy that you have? That's how I kind of look at it. Not like age doesn't really matter for a thing. So for fat transfer, I mean, yeah, I've done it on patients in their 20s or 30s, and patients in their 70s. I mean, there's no specific age range. It's just, when you do fat transfer, you just want to make sure that you maintain kind of a weight that's consistent. You don't want to do that and then gain a ton of weight, because you could gain weight a little bit more in the area where you put it. But other than that, I mean, it's very well tolerated. It's a permanent thing. If you have a problem, it's fixable.
Right.
Another question related to all of this is, could you do the fat transfer under the eyes?
Yeah. So it depends. Like, so can you do fat transfer under the eyes was the question. Yes, you could. It just depends where. If it's on the eyelid itself, there's certain reservations that you might have because I don't really.
I need to interrupt. You know, doctors call this lower part the eyelid too. So,
Yeah. So.
like this part right here is the eyelid. I just thought that this was the eyelid, but it's
like
down
if you
here
were to
too.
feel right here, you can feel it like a bone. That's like the orbit. Below that, you're safe to do stuff. If it's on the eyelid itself, there's more limitations of what you can do there.
So
That's gonna
filler
be
would
more-
probably be a better option.
Well, it really depends on the individual patient. Like maybe they need to redrape the skin or trim some skin, or sometimes the fat in the lower eyelid can be protuberant, and then you see a little groove in here. In that situation, usually I take the fat in the lower eyelid and move it into that groove versus transferring fat from some other place.
Sounds like whoever that is needs a consultation
That's
with
more
Dr. Ellstrom.
an individual consultation because anatomy makes a huge difference.
Yeah. Are there any other questions from the class?
Not yet. Maybe we can
Okay.
talk about recovery time for that person, any of those factors.
Well, I don't want to keep everybody too long. So we're gonna wrap things up. So if anybody has any questions, you know, like please send them right away. You know, Dr. Ellstrom's had a very long day. He didn't even get dinner. So we're going to need to get him fed so that he can take care of all of you guys tomorrow. I'm like, you know, going to like put him to work tomorrow. So, and so let me just remind everyone if anybody's going to ask any questions, Dr. Ellstrom and I are going to get together and do another live show with Dr. McNeil. We're going to do it next Thursday. It's not going to be at his lovely home. It's going to be at the office, probably close to like after work time, like 5 or 5:30 and around there. I will let you all know. But it's going to be interesting because what I want to talk about is like kind of like it's not a battle because they're friends, but like, you know, certain things that you can tackle with dermatology and certain things you can tackle with plastic surgery, and let each provider kind of explain their reasons for what they think would work best. So if somebody has a little pooch on their stomach, is it cool sculpting and true sculpt, or is it abdominoplasty or liposuction? Isn't that going to be fun? Like we'll go through a bunch of things like that, and that'll be next Thursday in around 5 or 5:30, depending on when they finish with patients. Maybe I'll like give them a snack before we can start talking. But tune into that if you want to hear more from Dr. Ellstrom. And then tomorrow night, I'm going to be in San Juan at Dr. McNeil's home, and we're going to be talking about all things dermatology, what's new in dermatology, what's coming down the line, what's like the super hip stuff, what's, you know, all of that fun stuff. We'll get to it with her on tomorrow. Okay? And then if there's any more questions.
We've had quite a few comments of people saying how informative this was.
Great.
And thank you, and how excited they are to hear that next topic. So.
Okay. And, you know, I know Dr. Ellstrom's really handsome. He's kind of intimidating, but he's actually a really nice guy. Like, I remember when I first met him, I was like, oh boy, like he's too cute to be nice. And he really is.
A little bit.
He is really kind. He's a very caring surgeon. You do so many follow-ups with your patients, Dr. Ellstrom. Like, he wants to keep track and make sure that everything's healing just the right, perfect way. And so I would really trust him with my care and with any friend's care, any my family. So I feel confident in saying that you all would be in good hands if you wanted to have a procedure done with him. So hopefully you
That's
make
very
an
nice,
appointment. I mean it wholeheartedly. Like, I really do. I wouldn't lead my followers astray.
We have a Dr. E is the best.
Dr. E
that's
is
very nice.
the best. And
We will be posting this.
we will post this onto our Instagram TV on NBDPS, and I'm still building followers with the Kicking It with Kerry, but my plan is to kind of do more little talks like this and to just kind of educate you. So if you have any questions, topics you want to cover in the future, please
Let us know.
DM me, slide into our DMs.
Oh, wow.
Okay, thank you guys, and
All right.
good night.
Good night.
Can we say good night? You gotta hit pause. You gotta hit done. Donezo.